Okay, let's unpack this. Have you ever tried to, I don't know, solve a really complex puzzle?
Hmm.
But imagine half the pieces are just scattered all over your house. Some are under the sofa, maybe some are still in the box, others you're waiting for in the mail.
Right, that feeling of trying to piece things together when nothing's in one place.
Exactly. That feeling, that kind of disjointed information hunt, it's not just frustrating for us, for our doctors, it's a profound daily reality. And it's contributing to this crisis that's kind of hiding in plain sight, doctor burnout.
Yeah.
So today we're doing a deep dive into this topic that really it touches every single one of us, directly or indirectly. Physician burnout. It's way more than just long hours. It's a systemic challenge, and it has these huge ripple effects on our whole healthcare system, and on the well-being of the very people we trust with our lives. We've pulled together some really compelling sources, recent surveys, some really vivid day-in-the-life accounts, and also some emerging solutions to try and get to the heart of what's fueling this silent epidemic, and maybe more importantly, what might actually help heal the healers.
And what's truly fascinating here, I think, and maybe often overlooked, is how this isn't just some personal struggle for individual physicians. It's really a systemic breakdown.
Right.
And what's more, this system issue, it kind of inadvertently disempowers the doctors who are stuck navigating it. It's ironic, right? It erodes that human element that probably inspired most of them to go into medicine in the first place.
That's a really powerful point.
Yeah, the real insight, I think, is that technology, when it's poorly designed or maybe just poorly implemented, can actively work against the core mission of healthcare instead of supporting it like it should.
And the sheer scale of this challenge is just, well, it's stark. The numbers paint a really concerning picture.
They really do.
There's a recent AMA Pulse survey. It showed nearly 40% of physicians are screening positive for burnout.
40%.
Yeah. Just think about that for a second. That figure is way higher than the general workforce. It really points to a unique kind of pressure within medicine.
And when you connect that to the bigger picture, these aren't just, abstract statistics floating around.
Yeah.
They represent a profound strain on our whole healthcare infrastructure. This widespread burnout, it contributes directly to physician shortages, especially out in rural areas.
Right. I've seen that.
And that can lead to longer wait times for appointments, less access to specialists. It really highlights a critical vulnerability in the system that's supposed to keep us healthy.
And it gets even more intense when you look at other data. Medscape's 2025 well-being report, they found an even higher number.
Oh, really?
Yeah, staggering 47% of doctors feel burned out, and about 1 in 4 report symptoms of depression.
Wow, almost half.
Almost half. And while, the absolute peak we saw during the height of COVID, which hit this shocking 63%.
Which was astronomical.
Astronomical.
Yeah.
While that's eased off a bit, we're still hovering just under 50%. And this isn't just like data on a spreadsheet.
No, it's people.
It's people. It means roughly every other white coat you see walking down a hospital hallway or in a clinic is potentially struggling, often silently. It's just pervasive, impacting the people we really depend on.
It's incredibly pervasive.
So to really get what this looks like, we need to move past the cold numbers, right?
Right.
We need to step into their daily lives. What does burnout actually feel like on the front lines?
Yeah. What's the day-to-day?
Well, take the story of Dr. Nguyen. She's a dedicated community pediatrician. Her clinic officially wraps up around 5:30 p.m.
Oh.
But instead of heading home to her family then, she spends almost 2 more hours every single night just finishing patient charts.
2 hours?
After hours. Yeah. This is what a lot of doctors call pajama time. Hours of administrative work just bleeding deep into their personal lives, ceiling time with their own kids, or even just time to rest.
Pajama time. That phrase really captures it.
Doesn't it? It's not just about being dizzy. It's about work completely consuming your life long after you've physically left the office.
Which brings us to a really crucial question. What's actually driving this level of exhaustion? Because it's clearly more complex than just long hours, although those definitely play a part.
Sure.
We're talking about these compounding factors like pervasive staffing shortages. That means increased patient loads for the doctors who are left.
Right, picking up the slack.
Exactly. Then there's the constant, just overwhelming barrage of inbox pings. Patient messages, lab results, refill requests, endless prior authorization forms.
Oh, the prior auths.
Yeah, each one demanding immediate attention. And significantly, there's this growing issue of moral injury.
Explain that a bit more.
It's that profound psychological distress doctors feel when they're forced to act in ways that violate their core values.
Yeah.
Like feeling they're just clicking boxes, navigating these clunky systems, instead of truly connecting with the actual human being sitting in front of them.
So it's a disconnect.
It's a profound disconnect from the very reason many of them went into medicine in the first place.
That is such a vivid way to explain moral injury, and it ties directly into another common experience, like Dr. Ali. He's an ER doc in a rural hospital.
Okay.
During his 12-hour shift, he reports spending over 6 hours, that's half his shift, glued to the electronic health record, the EHR.
6 hours on the computer.
Meticulously documenting, navigating screens, clicking menus, instead of directly engaging with his patients. Imagine trying to deliver critical care, make rapid-fire decisions, provide comfort, when half your time is spent wrestling with a digital labyrinth.
It's hard to even fathom. It's not just inefficient. It must be so emotionally draining.
Totally. And when you combine that with all the increasing administrative burden, it's really no wonder physician turnover is becoming such a massive, massive problem.
Yeah.
Replacing a physician, the costs are now estimated up to $500,000 per person.
$500,000.
Yeah. When you factor in recruitment, onboarding, training, the ripple effect on the staff who remain, it's huge.
That kind of turnover is just unsustainable. Period.
Yeah.
It's not sustainable for the healthcare system, which loses vital expertise, institutional knowledge.
Right.
It's definitely not sustainable for the hospitals trying to staff shifts in clinics, which often just puts more burden on the remaining doctors.
Vicious cycle.
It is. And most importantly, it's not sustainable for patients. They experience disruptions in their care, longer waits, and maybe a diminished quality of interaction with their providers. It's just a costly, damaging cycle that really demands solutions.
So, okay, if it's not just about the long hours, what's the core issue here? It seems to come down to something we're calling the scattered patient effect.
Scattered patient. Explain that.
Well, burnout seems critically linked to this fragmentation of information. Picture one single patient. Their critical lab results, they're stored in one digital portal.
Okay.
Their imaging results.
Yeah.
In a completely separate system.
Right.
Maybe crucial PDF referrals or consult notes arrive via email. And their actual comprehensive medical history, their whole story, it just doesn't exist anywhere in one cohesive, easily accessible place.
And what's truly fascinating, or maybe alarming, is how this extreme lack of centralized, unified information directly contributes to what we call cognitive overload.
Right.
And a heightened risk of error. When a doctor's precious cognitive bandwidth, that limited mental energy for focus, processing, critical thinking, is mostly spent just navigating these disjointed systems, hunting for pieces of a patient's story.
Yeah, just finding stuff.
It profoundly detracts from their ability to actually apply clinical judgment effectively.
Yeah.
Their mental energy gets eaten up by the logistics of retrieving information, instead of the nuanced assessment of their patient's health, the complex decision-making needed for good care.
And decision fatigue must be huge by the end of the day.
Oh, absolutely. Significant decision fatigue.
And that fragmentation, it creates what's basically a digital scavenger hunt for clinicians.
That's a good term for it.
It robs them of their focus, significantly increases the risk of missing details, or maybe ordering duplicate tests. Think about it. If a doctor misses a critical lab result because it was buried somewhere obscure, or orders a redundant MRI because they couldn't quickly find the report from an earlier one, it's not just inefficient.
No, it's potentially dangerous.
It's bad for doctors, adding to their frustration, their burnout. And it's certainly bad for patients who might undergo unnecessary procedures, face higher costs, or, most alarmingly, have critical information overlooked that could really impact their health. It just creates friction everywhere.
Yeah, friction at every turn.
But what if there was a way to untangle this digital chaos? What if we could give doctors back their time, their focus, and crucially, that connection with patients?
Okay, so moving towards solutions.
Yeah. What if the answer to this information labyrinth isn't about just working harder, but working smarter, using intelligence woven right into the clinical encounter?
That sounds promising.
This is where the narrative really shifts, I think, from just outlining the problem to looking at truly transformative potential. Our sources highlighted several promising approaches, and one innovative solution really exemplifies how technology can actually support caregivers. It's an ambient AI.
Ambient AI.
Yeah, think of it like this. While a doctor is just talking naturally with a patient, this quiet technology listens in the background. It seamlessly organizes, stitches together every relevant document, every lab result, every past encounter into one coherent, immediately accessible patient story.
So no more hunting.
No more copy-paste gymnastics, no more logging into 5 different systems, no more digital scavenger hunts to get the full picture. The system we learned about is called Othisis.
Okay, so how does a solution like that practically address the very real challenges we've just spent time outlining?
Good question.
Well, first, it seems to directly tackle that endless charting, the thing that leads to pajama time. So instead of doctors spending hours after clinic just finishing notes, the system apparently delivers ready-to-sign notes before the doctor even leaves the exam room. Imagine that kind of efficiency gain.
That's huge. Game-changing, really.
It seems like it. Second, it addresses those fragmented records we talked about. You know, the labs, referrals, consult letters living in different silos.
Yeah.
This tech seems to transform them into a single, comprehensive conversational timeline. It seamlessly threads outside documents and relevant data right into the encounter summary. So you get this truly holistic, unified view of the patient's history, no matter where the info originally came from.
Wow.
And this kind of integration is also crucial for maintaining compliance with regulations like the Health Insurance Portability and Accountability Act, HIPAA, by keeping all that necessary patient data securely within one organized system.
Okay, so it helps with compliance too. Makes sense.
Thirdly, and maybe this is the most important part, it helps restore that lost patient connection. Well, if doctors are no longer glued to a screen, meticulously typing and clicking away.
Right, head down.
This kind of hands-free capture lets clinicians actually look patients directly in the eye again. They can fully engage, pick up on nonverbal cues, foster that genuine, empathetic connection that's so vital for building trust and delivering really effective care.
Getting back to the human side of medicine?
Exactly. And finally, just by streamlining these incredibly burdensome administrative workflows, it significantly reduces both mental fatigue and that risk of errors we talked about.
It frees up brain space.
Precisely. It frees up that critical cognitive bandwidth. It lets doctors focus their mental energy on applying their clinical judgment, their expertise, rather than being constantly bogged down by the sheer volume of admin tasks.
And is this actually happening? Are we seeing results?
Well, according to the sources, the impact of these kinds of solutions is already being seen. Pilot clinics using this type of ambient AI technology are reporting truly remarkable results.
Like what?
Handing back 2 to 3 hours to each provider. Every single day.
2 to 3 hours a day. Per doctor.
That's what they're reporting. Imagine what that time means. Time spent with family. Maybe time dedicated to quality improvement projects in their practice. Or just time to breathe, recharge, look after their own well-being.
That's a profound shift.
It really is.
Yeah.
It could transform the daily experience of being a physician and, in turn, the quality of care they're able to deliver.
So, okay, wrapping this up, what does this all mean for us? Burnout. With all its systemic pressures, the fragmented information, it might feel like it's just an inevitable part of modern medicine.
Yeah, like it's just the way things are.
But it truly isn't destiny. It doesn't have to be this way. When clinicians get their time back, when they get clarity, when they're empowered by intelligent solutions that actually help them, patient care doesn't just improve a little bit, it flourishes.
It really does. It's about empowering our healers to do what they do best. Heal. And do it with renewed focus and, importantly, connection. And maybe this leads us to a question for you, the listener, thinking about your own life, your own work. What systems could benefit from a similar kind of streamlining?
Interesting thought.
Are there digital scavenger hunts you find yourself on every day? Maybe managing project documents scattered everywhere? Sifting through endless emails, juggling personal tasks across 5 different apps?
We all have those, right?
We probably all do. So consider how clarity and cohesion, the very things that are starting to help combat physician burnout, could transform that feeling of overwhelm into actual effectiveness, really in any field. How could simplifying things give you back your most precious resources, your time and your focus?
Something definitely worth thinking about. How can we untangle our own digital chaos?
Exactly. Food for thought.